Yes, I wanted to address another point that I hear from folks in central New Jersey about a lot. They get letters from their insurance companies saying Medicare is going to be cut. And, you know, again, it's misrepresentation, and we want to clear that up. Let me give a little history about Medicare Advantage. You know, a number of years back, the insurance companies came to the then Republican majority in Congress and said, you know, the government is really inefficient. We, the insurance companies, can provide the benefits of Medicare a lot more efficiently than the government can. In fact, if you give us 95 cents on the dollar, we will provide benefits to Medicare beneficiaries.
Plus additional things. We're
right.
So good at it.
And we're so good. And so eager to move services into the private sector, in other words, to privatize Medicare, the then congressional majority said, fine. Well, it didn't take more than a couple of years before the insurance companies came back, tears in their eyes, hat in their hand, saying, well, we can't really do it for 95 cents on the dollar. It's actually about $1.15 on the dollar. And those who liked privatization said, hey, that's still a great deal. So right now we find ourselves where 20% of Medicare beneficiaries are getting Medicare benefits, and we are paying insurance companies a 15% premium to provide those benefits.
And who ends up paying for that?
All taxpayers and the other Medicare beneficiaries. So, yes, those insurance companies are, under this health care legislation, not going to get paid for doing no more than the federal government does at a dollar on the dollar. We're not doing away with Medicare Advantage. We're just saying it's not going to be a giveaway for the insurance companies. So they'll get $1 worth of payment for $1 worth of services rendered.
Oh, that's so unfair to the insurance companies. That you take away their bonus for doing nothing more than you can do in another system.
Ask your seniors. There are about 20% of Americans who are on Medicare who are part of this Medicare Advantage program. Ask them how many letters they have gotten from their insurance company saying that the sky is falling and that if Congress goes through with this health care reform, it'll be curtains. Well, what it means is there will be fairness once again restored to the Medicare program. Medicare beneficiaries will get $1 worth of services and benefits for $1's worth of expenditures. And that's the way it should be.
That current unnecessary bonus that's given to the insurance companies will be brought back and reinvested in the Medicare program so that the Medicare program's solvency will be extended into the future. So we're not taking that money away from the Medicare program. We're taking it away from the insurance companies, bringing it back to the Medicare program. And the Senior Advantage program is not a free program to seniors. They're paying for it. They're paying a premium themselves. And the federal government is paying an unnecessary premium to the insurance companies. Do what doesn't cost any more in the regular system. So it's a great savings. It's something that should be done. And oh, the tears.
Yeah.
The wailing and crying by the insurance companies.
And it's based on a fallacy.
Yes, exactly.
Because Medicare has low administrative overhead. It is an efficiently run program. And as a result, Medicare's costs have grown
3%?
at a slower rate.
What is it, about 3%?
It's a couple of percent.
It's about 2%.
And Medicare's costs grow at a slower rate, at least they have over the past 5 years, than the private health insurance for the same benefits.
Well,
so it's just another indication of the efficiency of Medicare. And every year, the government makes some changes. Ever since 1965, there have been changes made from time to time about Medicare to make it a more efficient program and to make it more directed toward healthy outcomes for the seniors.
That's a big piece of what is going to happen in this reform, is that there will be a continuing study going on through the Medicare offices and the Department of Health Services to find better ways of treating seniors. You talked about the home care, which we know is a better way of doing it, the continuity of care. We know that over time new medical devices are found, new medical services are brought online, and other services that have become obsolete are taken off the benefit list, and new ones are brought on over time. That's the way it is, because Medicare medical services are constantly evolving and changing. Drugs, the kinds of services, the hospital services, all those things are evolving over time. So change is constant in this program. And specifically in the legislation is an effort to bring online those new techniques and technologies that enhance the care of seniors. And I will also say for other Americans, so all of us, as a major part of the program, specifically for seniors, and it will roll on. Clinically proven services, evidence-based services. And these kinds of things save costs. And again, the insurance companies are going to cry. The U.S. Chamber of Commerce is spending over $100 million in this last month or two with advertising, all designed to kill the reform effort.